Hi there. My name is Corinne Goodwin. I'm one of the leaders of Lehigh Valley Transgender Renaissance, and I'm also the Executive Director of the Eastern PA Trans Equity Project. Welcome to our educational video series for transgender and gender-diverse people. Today's topic is masculinizing hormone therapy, and our expert is Sandra Messick. Sandy is the director of the St. Luke's School of Nursing and is a recognized authority on transgender healthcare. So without further ado, here's Sandy.
Initiating masculinizing hormone therapy can be a significant time for transmasculine people, and you have come to the right place to learn about it. In this short video, we are going to review the types of masculinizing hormone treatments that are available, the effects of the masculinizing hormone treatment, and the health considerations you should be aware of when undergoing hormone replacement therapy, or HRT. Starting medical transition is an exciting time, especially as you begin to see bodily changes and what will feel like a second puberty. But it's important to remember that these changes and the extent and rate at which these changes take place depends on many factors such as age, genetics, and your general health. So listen to your healthcare provider and be patient, as it often takes several years for the full effect of hormone replacement therapy to be seen. Testosterone is the medication that most providers will prescribe when helping a transmasculine person with medical transition. You might think that taking higher doses will bring about faster body changes, but this is not necessarily the case. In fact, dosing at higher levels could endanger your health, so be sure to follow the guidance of your healthcare practitioner. Most transgender men are prescribed an injectable form of testosterone to start with. Some choose to begin on a lower dose and increase slowly, while others may decide to begin at a standard dose. Both approaches have their pros and cons, and you should discuss the options with your provider to ensure that you are doing what's best for your situation. It is generally recommended that you give yourself injections on a weekly basis. Your provider will teach you how to do so. If you are uncomfortable or unable to give yourself injections, you may want to ask your medical provider about transdermal options. These include patches, gels, and creams that are applied to the skin. It should be noted that body changes may occur more slowly when using these forms of therapy, and that you need to be careful about not transferring the medication to others through touch or body contact. So it is important to wash your hands thoroughly after application. Regardless of the type of testosterone you're taking, it's important to know that taking more testosterone will not make your changes progress more quickly. Just like putting mustard on a hot dog, more is not always better. Excess testosterone can lead to significant anxiety and very serious risks to your health. It can actually convert to estrogen, which would be counterproductive. The key is to be patient and remember that, like any changes associated with puberty, they can take several years to develop fully. As your hormone therapy progresses, you can expect some significant changes to occur. These fall into several categories: physical, emotional, sexual and libido, and reproductive impacts. You should always discuss these things with your healthcare provider, but let's take a high-level view of these right now. One of the first changes you will probably notice is that your skin will begin to change. It will begin to feel thicker, and your pores will become larger. It will also tend to become oilier, and you may develop acne. In most cases, this can be managed with good skincare practices and common acne treatments. You'll also notice that the odors of your sweat and urine may change, and that you may sweat more overall, so it might be a good time to try a new or more powerful deodorant or antiperspirant. You might even find things feel different, including how you sense changes in temperature. Next, you will find that your body fat will begin to redistribute. Fat may diminish around your hips and thighs, while your arms and legs develop more muscle definition. And generally, your muscle mass will increase, as will your strength. But you should also keep in mind that you may also gain fat around your abdomen, similar to many cisgender men. Overall, you may gain or lose weight after starting hormone therapy. Your eyes and face will begin to develop a more angular, male appearance as facial fat decreases and adjusts. But you should also note that it's not likely your bone structure will change in any significant fashion, and that it may take 2 or more years to see the final results of your facial changes. One of the first things transmasculine people ask about is voice changes. It is highly likely that as a result of your masculinizing treatment, your vocal cords will thicken and you will develop a more male-sounding voice. Voice changes may begin within just a few weeks of beginning testosterone. You can further enhance your voice through practicing vocal techniques or working with a speech therapist. Now, let's talk about hair. The hair on your chest, back, and arms will become darker and thicker while growing at a faster rate. You will also find that the pattern of your body hair will develop similarly to other men in your family. Just remember that everyone is different, and it could take 5 or more years to see the final results. The hair on your head will likely change too. Most trans men notice some degree of balding, especially in the front. And depending on your age and family history, you may develop male pattern baldness or even complete hair loss. Finally, everyone wants to know about facial hair. This can vary from person to person, and while some trans men will develop a thick beard over a period of time, others may not. Your genetic background and the age at which you start testosterone therapy will have an impact on this, but many transmasculine people find that their beard will begin to grow in fairly rapidly. Puberty can be a roller coaster of emotions, and the second puberty that you experience during your transition won't be an exception. Trans men often find that they become somewhat more detached from their emotions than in the past, and that they may become somewhat quicker to anger or more short-tempered than before. You may find that your interests and hobbies change, and this can impact your relationships with others. That's why many trans men find that they benefit from working with a therapist or counselor as they work through the process of transition. Soon after beginning hormone therapy, you will likely notice changes in your libido and the way you think about sex. Your clitoris will begin to grow and become larger when you are sexually aroused, and your orgasms will feel different. This may include a greater focus on your genitals than a whole body experience. You may also find that your feelings around sexual orientation begin to shift. These feelings are natural and are a great thing to discuss with a therapist or other people that you trust. Just make sure that you always practice safer sex. Your reproductive system will also change as you work through your transition. While everyone is different, for most trans men on HRT, their periods become lighter and shorter in duration and will ultimately stop altogether. But it is important to remember that transgender men can still become pregnant while on testosterone. So if you are sexually active with a non-transgender man, you should always use a method of birth control to prevent unwanted pregnancy. And if you suspect you may have become pregnant, you should discontinue testosterone treatment and see your healthcare provider as soon as possible. While testosterone therapy is generally considered safe, as with any medical treatment, you should be aware of the risks, get regular checkups, and discuss any health changes or questions with your provider. Let's talk about some of the health-related factors you should be aware of when taking testosterone therapy. As a general rule, once you have been on masculinizing therapy for a while, your overall health risk profile will resemble that of a cisgender man. This means you may be at higher risk for heart disease and diabetes. Your blood pressure and cholesterol may also increase, but these risks still may be less than that for a cisgender man. There are some specific risks that are associated with testosterone therapy that you should know about. Chief among these is that you may encounter a high hematocrit, which happens when your body produces too many red blood cells. This results in a thickening of your blood, which can be a dangerous condition that can lead to heart attack, stroke, or other serious conditions. Because of these potential issues, your healthcare provider will order periodic blood tests, which will include a check of your blood count, cholesterol, kidney function, liver function, and a diabetes screening along with your testosterone level. If you miss a dose of testosterone or change your dosage, you may experience a small amount of spotting or bleeding. However, if your periods have stopped, be sure to report any return of bleeding or spotting to your provider, as it could be a sign of an imbalance in the lining of your uterus, possibly due to a precancerous condition. Most transgender men continue to keep their natal reproductive organs intact, and that means you should get regular reproductive health checkups. This includes screenings for ovarian, uterine, and cervical cancers, plus HPV through regular pelvic exams and pap smears. Some providers recommend that their transmasculine patients undergo a hysterectomy, as it can minimize the risk of cancer and eliminate the need for many screening tests. Finally, regular mammograms are also important for your health. This is even the case should you choose to have top surgery to remove the breasts, as there is always a small amount of residual breast tissue left behind. The good news is that the incidence of breast cancers is very low in trans men who have had chest reconstructive surgery. We are excited that you are considering medical transition to affirm your gender, and now you know more about what to expect from the experience. In most cases, it is safe, effective, and highly affirming. We hope that this video has answered many of the questions you may have had. Thank you and good luck.